So we get a little post-workout recovery for Big Matt. As you can see, so we're using some instrument-assisted soft tissue mobilization tool by one of the tools by Factor. Purpose here is to create some changes within the tissue. He's red because there's a very big sympathetic dominance to his these tissues. So as we create some autonomic changes, we're increasing blood flow to the area, as well as creating some changes within his nervous system that will help to dampen down that sympathetic dominance. And this is great for recovery, for lifters, for athletes. It's tremendous for people that have pain, specifically low back pain. Come over this way too. You can see some the work being done a little bit more closely. So Matty here just finished a big deadlift day, and his paraspinals into his low back take a beating. But what we're going to do is we're going to hit these areas, and then he's got a right hamstring that's a little bit acting up right now, and then we're going to do some DNS work to follow that all up with, just to kind of keep everything on par, keep him feeling good, basically kind of keep his body set and performing at its best. He's a big boy, so I gotta get a little bit of weight behind him. All right, Matty, let's have you flip onto your left side. Okay. All right. Okay. Okay. And then, okay, good. All right, so we finished up the tissue work and body work for Matt. That was some myofascial release, instrument-assisted soft tissue work, and then we also did some joint mobilizations and adjusting for his spine, his hips. But now we're going to focus on a technique with your dynamic neuromuscular stabilization. So we ran through a couple quick screens with Matt because there are a couple areas we want to get fine-tuned, keep him healthy during his training cycle. And what we're going to show you here is what we found is he's got a little bit of issue going on the left side in terms of his quality of neuromuscular control and firing, and just basically his stabilization patterns. So to kind of address that, we're going to start him here. Matt, bring your legs up into this position here in a 90-90. While he's here, he's going to focus on just keeping his ribs down. He's got some good intra-abdominal pressure. And I'm just going to apply some resistance to him. Just meet my resistance. Good. And again. Good. Don't let me push. Good. Now I'm going to bring his hands up. Okay, just kind of like soft pulse. Okay, good, just like that. And don't let me push. So what we're focused on here is as he's meeting my resistance, in this pattern, I'm resisting his rolling. And so rolling is an ipsilateral pattern. What I'm primarily trying to address here is how he's stabilizing through his trunk, but also trying to improve some of the rotational qualities of his left hip. Good. All right. And then down for me. what I'm looking for there is as he meets my resistance and there's less of a giveaway, then he's firing up and he'll just lock right into place. And that's what I'm trying to achieve there. I'm going to have him turn on to his right side. Or excuse me, left side. Left side. Yep, my bad. Okay. All right. So from the left side, Matt, come up on your elbow. Right here. Good. Okay. This leg's coming up. Good. So around here. Good. So in this position here, I'm just going to get him set. Don't let me lift this knee here. Okay, so keep that leg solid down. Foot lifted here. Good, so don't let that foot come down. Good. Now from here, meet my resistance. So he's a big boy, strong boy, and even just with a little bit of a lean, he's budging. So I don't want that. We're working this posterior oblique sling, which is some of the lats, some of the obliques. Get into this downside hip, in this case this left hip, glutes, and proving how all of those link up as a sling. There we go. There we go. All right. On your back again. Okay. So this side was the tighter side, right, Matt?
Yeah.
Okay. So come in here. We're gonna just check your internal rotation to start. Cleaner here. Now, first screen here, go ahead and bring that up. Okay. Less tension?
Yeah.
Okay, and check this one here. Keep this leg bent for me, just like that. Lock and lift that leg. Good. How's that feel through there?
Much better.
Okay. So that's just a couple of little techniques that we use for helping improve his hip, taking some of the tension out there. Now, lastly, what I'm going to do is, because he's actually having some issues on the right side in loading, so I'm going to have you come actually off the table next to that. So his right hamstring was a little angry. And so what we're going to do next is just a little technique to help with the loading of that hip and quieting down that hamstring. Okay, so Maddie, you're coming up on the table like so, okay?
Okay.
Left knee up. Okay, good. And then this hand, elbow, just like that, okay? This arm right back here like that. Good, good, okay. And this knee, come on out here, okay? So don't lose your foot position, widen out just a little bit for me. Bring the foot out here, good, just like that. Okay, so let's start at the foot, okay? Hold, rotate this out a little bit more, good. Don't let it push you in. Good, good. And then on this one here, so hold that.
Okay.
Hold that out. Good. Here. Okay. You feel me here?
Yep.
Meet my resistance, so don't let me push you away. So what we're doing here is we're getting a loading of his left shoulder. And I'm cueing him against my resistance as I fight against basically the pull of his serratus anterior. It helps stabilize his shoulder blade on his rib cage. He's got that down. And then this one too. Lift right up here. Move my finger. Good. Good. And from there, good. Now, come forward just a little bit. Good. Good. Okay, now what I want you to do is from this position, come up tall, right through that hip. Good, back down. Come up tall, swiveling through that right hip. Go ahead. Good, down again. Okay, good, hold against here, swivel up through the hip. There you go. Good, let's do one more. Good, all right. Good, on your back. Did you feel that one mostly?
A little bit everywhere.
Yeah. Right hip, huh?
Yeah.
Good, all right. Bring this up here. Okay. Go ahead and hug that in.
Yep.
Good, okay. Yeah. All right, feel good?
Yes,
Go.
sir.
We're done.